couple years, and hopefully at least give a couple pearls in conjunction with our other presenters today. Next slide. All right. So why do we want to even talk about transition? You guys all have lots of good reasons why you want to be talking about transition, but I'm going to spend a couple slides just on some of the statistics that we do have, so that we can kind of frame some of the conversation around that. We know, first of all, that, and this slide is not specific to individuals with autism, but 20% of the United States population is between the ages of 12 and 26, so decidedly within that transition age range, and that's a pretty big chunk of us, right? This is also a time fraught with many things. It's a stage of really rapid change, both in our bodies and our minds, this sense of growing independence. In general, tend to regard healthcare as a lower priority compared to people in other age ranges. Health risk behaviors can start to peak in this time frame, and we can also see higher rates of behavioral health challenges beginning to emerge or maybe becoming more challenging. And this is also, of all the different age ranges, the lowest utilization of healthcare. And so, as you can imagine, that can make it even more challenging. Next. All right, and then to talk specifically about individuals or adolescents and young adults with special or more complex healthcare needs. If you do choose to read this article that's cited here, they'll use that SHCN abbreviation, so that's what that stands for. It does include individuals with autism or intellectual disability or other developmental disabilities. But most people who fall into this category and are in that adolescent and young adult age range do not receive transition support. In fact, we know that, when this study was done a couple of years ago, 83% were reporting that they didn't receive transition support or guidance in the medical home. However, as you can imagine, and as Maddie pointed out in the case, many do require some decision-making support. And so thinking about how many people aren't getting it and need it is really concerning. We also know that having a good transition plan in place for transitioning to adult medical provider improves adherence to care, perceived healthcare status, so you feel more well, improves quality of life, improves self-care skills, and you have decreased hospitalization rates. So lots of reasons we want to do these things. Next. All right, and then some more barriers as well. So specifically, this slide is really talking about some of those barriers that are really embedded within the medical community. And so I think it's important to know, because as you're maybe in the process of transitioning your young adult or adolescent to a more kind of adult healthcare setting, these are some statistics that I think we can learn from. So the majority of providers who provide adult health care do cite a lack of training and a lack of comfort in caring for individuals with intellectual and developmental disabilities. Only 36% said they felt like they did get adequate training. And 90% feel like this population may be more difficult to provide some care for. And so I think those are some pretty daunting statistics, when we look at that. However, the data also supports that the overwhelming majority, so 84%, really do want to provide good care and good quality care and are open to doing so, but they just feel like they need some help in this, some more training and some more help potentially even from us as pediatric partners. So for me, for example, I consider that a big piece of my job is to help our adult medical care providers be able to feel more comfortable assuming medical management for some of the patients that I am sending their way. And in addition, I think you as family members, friends, parents may also be able to advocate as well. Next. All right, and so when I say that you can also consider some ways that you might be able to help adequately advocate for your individual that is either a family member or friend with autism spectrum disorder, I say first, maybe just feel empowered to ask some questions. So number one, I would say one of the easier questions that you may consider asking is, hey, do you guys in your office have any training in autism spectrum disorder? And if you do, who all is included in that training? Because sometimes just because there's been training doesn't mean that all the staff has been included in that training. And then, you can always plug Echo Autism as a great way to learn more about it. We have Echo Autism specifically for providers as well. And then asking about the policy for transition. Number one, do you even have one? You'd be surprised, and I am continually surprised at how many, pediatric centers really don't have policies for transition to adult health care. And if you do, what exactly is in that policy? Is that policy being shared with patients? If it's not shared like on a continual basis, that when you turn a certain age, for example, maybe ask to see it, ask if you can have a copy of that. And then that parallel care piece, which can mean a few different things, but I think I would consider asking, well, if I'm having trouble transitioning, would you be able to maybe work with that medical provider that's in the adult world? Or would you be able to maybe see me back for a visit so you can help me troubleshoot as I'm trying to move forward? Next. All right. And so, I think those are some of the statistics and some of those tools that you guys can maybe use in terms of asking some questions as you're transitioning to adult providers. But I also think I wanted to present, you can go on to the next slide, that's totally fine. Some of those really common questions that I'm getting. We decided to kind of frame it this way this year, hoping that it might be a little bit more meaningful for you guys, because I'm asked about these things a lot. I think a lot of us are in our different capacities, and I'm just going to kind of go through some of the most common questions that I might be getting and some of the things that I've learned. So number one is, and probably one of the most common questions I get is, gosh, my pediatric clinic or my pediatric healthcare team has been so accommodating. They're used to being with us from the time we're an infant, until now this young adult. How do I prepare my autistic child to be seen in another healthcare setting, specifically an adult one? Next. And so I think this is where it's important to talk about, maybe getting comfortable with those medical appointments. I don't think it's wrong to say that it can be and feel more accommodating in the pediatric healthcare world, right? We might be more used to having to take more time, for example, for patients for a variety of reasons. Some of that may even be more likely to be built in. Our nurses are used to talking with family members as well. And so for many reasons, it does feel more accommodating. And while you're in that space where it is a little more accommodating, that might be a good time to focus on practicing some of those things that have been challenging to master, because everybody deserves to have the best care possible. And so you need to be able to get these vitals done, because even if your blood pressure is not super important for you when you're 12, right? If you've never had a blood pressure problem, things are fine. That may be something that when you're an adult is very important that you're able to monitor, and everybody should be able to access healthcare everywhere. And so maybe practice some of those strategies while you're in that pediatric setting. A few, little examples of things to try. So social stories, starting small, allowing individuals to participate to the extent they're able to do so. Next. You can also start by just creating a medical summary. So it's very tiny on the slide. I don't expect you to be able to read the little pictures, but those QR codes can bring you to the medical summary information for individuals with autism. And then there's a link for the GOT transition link as well there that can bring up some more transition resources that serve as ways to kind of help communicate these needs to your medical team as you move forward. It's just a place for you to be able to jot down all those kind of most important things, because, if you've got these thousands of pages in your record, you may not be able to efficiently translate all of that before that first meeting with an adult provider. But what you may be able to do is provide this couple-page summary of those kind of most important things to be able to take with you. Next. Woo. All right, let's see, go back. I think as we are getting back there, I think that piece of, we're almost there. I think that yep, there, perfect. Thank you. Our support team's been working real hard behind the scenes, guys. Thank you so much. So I'm worried that an adult provider may not understand their medical or behavioral needs. How do I help prepare for that? Next, another really common question, right? I think everybody performs better, us included in the medical world, when we have a lot of information to review ahead of time or important pieces of information ahead of time. So I think that calling ahead, sending a message via MyChart or whatever your electronic medical system is with your needs can really help set the stage for success. So, some examples of that would be things like, I want you to know ahead of our first visit that this patient does not do well sitting in a waiting room. We really prefer to wait in our car. Can we make a note of that in our chart? Can you call us before we come in? Is there a way that we can have an escape plan if needed? I did have a patient once call ahead and say, we've got about 3 minutes when I realize that it's coming and we need to make it to the parking lot in that time. I just want you to be aware that if I say we've got to go, we really do have to go, and that your staff knows to prepare for that. And that was super helpful information to have. Same thing about, if there's preferred communication styles, who the people are that are going to be joining you. Those are the types of things that I think can be super helpful as you're moving into meeting a brand new person who's going to be taking over your care. Next. All right. So as we age, what changes when my child turns 18 in the healthcare system? Right. Next. I'm definitely not a legal expert by any stretch. But I certainly, I think that in the healthcare system, there are some specific things that I've become familiar with that we need to counsel people about when you turn 18 years old. So first of all, it's just important to note that everybody has the right to make their own medical decisions when they turn 18 years old, regardless of their functional level, unless guardianship is obtained, okay? Parents and guardians also cannot access medical records unless the young adult agrees once they've turned 18. And that usually is by signing some specific documents saying, hey, you are allowed to talk to my mom or my dad or my sister still, okay? And then if you're considering something like guardianship or power of attorney, understanding the differences between those things and what that timeline might be, that you would need to be, completing paperwork and all of those things, having things signed by your medical team, for example, with guardianship, can be very helpful. And it may change a little bit depending on where you're at in terms of the timeline that it needs to be done. For example, somebody's already put in a plug for the National Center for Supported Decision Making, which I was really excited to see because I use that a lot. But just keeping in mind that the least restrictive is what is preferred. That doesn't mean that guardianship is never appropriate, because it certainly can be, but least restrictive is preferred because we don't take rights away unless that's something that's absolutely necessary. And power of attorney does not take away rights, but it does grant someone else the authority to act on your behalf. Those are just some important differences to know. Next. All right. So this is also a super common question that has a fairly complex answer, I think, but still important to talk about because I don't think we do a good job of setting people up, to understand this. But why do some of my specialists see me forever? Some might only see me till I'm 21 or 25. Some stop at 18. Next. And so at least in the medical world, that is probably because of a variety of different factors within the clinic. And so to really kind of peter it down quite a bit, you may have a clinic that sees people throughout their whole life if it's a specialty clinic that maybe is supported by adult medical providers. So an example of that is, sometimes there are congenital heart defect clinics that are housed in a pediatric hospital. So you keep going to that same pediatric hospital, but there are adult cardiologists who can consult and support with that team when those quote unquote adult heart problems start happening in those patients in addition to those pediatric problems. And so that would be a reason that in some cases you're seeing lifelong in a pediatric center. In addition to that, some providers also have training in both pediatric and adult populations. And so you might hear those doctors called internal medicine pediatric doctors, or just shortened to med peds doctors. That just means that when they did training, they did extra training to make sure that they got through pediatrics and your just general internal medicine. And so if you're getting your general health care from a med peds doctor, they might see you from birth until death, compared to pediatrics versus maybe family medicine. If they are, some family medicine doctors will and won't see pediatric patients, for example, or some internal medicine doctors won't see pediatric patients. And then some clinics have less support, less availability, and less expertise to see adult patients. But they should still be the main players in guiding medical transition, even if they can't see you as an adult. I think the other thing to consider is that not all policies are set in stone. If you're handed a policy that says we stop seeing young adults when they turn 18 years old, then and you also know, for example, that you're having multiple transitions at one time. So your neurologist and your rheumatologist and your general pediatrician, everybody's saying, hey, you've turned 18, we can't see you anymore. That's a whole lot of transition at one time, and probably too much for anybody to manage well, especially without a lot of supported guidance. So asking if there's a way that you can either have a graduated transition, which is where you might be able to, hey, once I get linked with a new adult neurologist, for example, then can we work on my transition from your clinic, right? Or that bridging of appointments, which is really more of a, why don't you go see your adult doctor? And then I want you to come back and see me after you have that first visit. Tell me how it went. Are there any things I can help support you with in this process going forward? So I might see you back 1 or 2 times, even after you've established with an adult provider. Next. And that is my last slide as we move on to these next presenters. I think Amy is going to do this slide.
Yeah, thanks, Lindsay. If you have questions, go ahead and chat them in. We'll have time at the end, but if you have something that's on your mind now, go ahead and chat it in. I think one of the things we wanted to say too, when you're thinking about working with providers as you're moving out of pediatrics and into the an adult provider, and I've done this with my own son, is that ask providers, ask them for extra time so that you can really talk through what are the issues and successes that your child has in completing clinic appointments. And I think, again, ask them to talk about what are the future things that we should look forward to? What are things that we should be prepared for? But I think also it's really important as a parent to identify what are those goals and strengths that your child has. We can do blood pressure, we can do temperature, we can do weight. We have a hard time with an EKG. We have a hard time with shots. So talk about what strategies may help in those kinds of things so that, again, you begin to work as a team to find ways to, again, make that clinic visit really successful. I think also ask them to help you prioritize next steps. What should I focus on? What should I be preparing for? As you age, you start to do different things in clinic visits. So, having some heads up of what do I need to be prepared for so I can get through those clinic visits with my child is a really good thing to ask providers to do. I think also if you can ask them to help you make connections into supports if you need to do any type of specialized care, that's really helpful. But I think also the thing that I would say is, promoting self-advocacy. I want Henry to go through an appointment in a clinic as much as he can individually, with the amount of supports that he needs so that he can be successful. And I always say, I want him to be able to get care here and anywhere so that if we're traveling and he needs to go to the doctor, he can go through those common steps of, walking into a clinic visit. And the other thing too is that, we usually bring a lot of people with us when we come to a clinic visit. So ask the provider to really think about how can you incorporate all of those perspectives, sibling perspectives, parents' perspectives, close friends' perspectives, whatever it might be, if they're part of that clinic visit to, have them be a part of that. And again, I think always trying to find a way to end on a positive note. Having worked in primary care, I know that when we leave a clinic appointment on a positive note, we are very much more apt to go back to that clinic again. If we end on a negative, I don't want to go back as much. So I think that's always something to really focus on. And I think getting your provider to celebrate your successes with you, again, to build that partnership is another great suggestion and strategy to use. All right. And Maddie, I'm going to hand it over to you.
All right. Thank you. So from an autistic perspective, what's really most important for autistic youth? This 12 to 18 year is probably the biggest change that the kids are going to experience and your experience as caregiver. They're growing and maturing and changing, and their role in life needs to start slowly changing, so that when they're an adult, they're more prepared for what the adult world is like. And one of the things that I have found very, very important is this whole concept of agency. Start off at, a younger age, that the kids, that important decisions relating to them, their care, the things that they're going to do, that they're part of that decision making, and growing it, and as they as they age toward it, getting closer to the adult time, that the agency is more of a co-ownership of their lives, of the responsibilities for the medical appointments, for things that you're still there to be, to go alongside them. But at some point where they're able to, there's a handoff to them being able to understand and know and make the decisions for themselves. And one of the biggest challenges that parents of autistic kids have in this time frame revolves around the fact that puberty and body changes, and the feelings, the emotions, we become more and more sexual beings, just like neurotypical kids, but we tend to not be as prepared as much for what that means and what that's like. And so it's really important that you accept that that's part of life, and you prepare them for what that means in a way that they're going to be able to respond to. And thus begins the puberty discussion.
Maddie, fantastic transition. This is Lisa jumping in here for the next session. So now that we've talked about a number of really important elements of healthcare transition, I'm going to talk with you a little bit about managing puberty and healthy relationships. And I have to say, this is not something that's always at the front of our minds, and it's sometimes uncomfortable and awkward, but as Maddie just highlighted for us, it's so important. So let's go ahead and dive right in. Next slide. So why is this all important? Well, unfortunately, youth with autism are at higher risk of physical and sexual abuse, neglect, and exploitation. This is not the good news, but we have a lot in our control to sort of contribute to the positive here. Social impairments in autism can also increase the possibility of engaging in inappropriate or problematic sexual behaviors, whether intentionally or unintentionally. This can lead to increased social vulnerability and even more serious problems. So I want us to think about two different kinds of behaviors that can be problematic related to puberty. This is going to include atypical behaviors that are not sexualized, but may be interpreted as such, right? So these are the things that are sort of unintentional and maybe part of our loved ones with autism's life. And as they're getting older, they could be misinterpreted or misunderstood in certain contexts. So things like sensory interest in touching hair or skin or the clothing of other people. And then sometimes we have to think about socially inappropriate sexual behaviors that may be misinterpreted as sort of intentional or deviant, when in fact they're really sort of a normal part of development, but may look different for an autistic individual. So the bottom line is, it's never too early to start teaching about boundaries, consent, and safety, and all of the things that we can do to build skills and knowledge and independence early will help to reduce later risk. So we're going to walk through on the next slides here a few important stages, and where I'll have you cruise to the next slide for us. I'm going to walk you through sort of how we think about starting to prepare for puberty even well before you think you need to. So for those of you who happen to be on the call proactively with younger kids and family members with autism, I would encourage you to start thinking about puberty now. If you have older children and teens, rest assured it's not too late. We're going to talk about some things you can be doing as well, but we're going to go through some general tips like being proactive, starting early, making sure that your IEP and school team is including your child in all health and sex education curriculums at school. This may need modification and support, right? And we need to advocate for those appropriate modifications and supports. And finally, find low pressure times to talk about some of these uncomfortable topics with your family members, like maybe when you're riding in the car or taking a walk. Next slide. All right, so we're going to cruise through really quickly early childhood and some of the school age years. But by early childhood, I really want you to think about teaching body parts and anatomy, including the correct names for those body parts, teach consent, and always ask for permission before touching, not forcing any physical contact like hugs or kisses. Make sure that your child knows that only doctors and parents can see or touch their private parts in certain situations, right? Like helping with a bath or at a medical appointment. Provide clear instruction and modeling for public versus private behaviors, and modeling those things at home is just as important to teach and lay a nice foundation for how your child will learn public versus private behaviors outside of the home. Also teach your child to ask before touching other people, even at a young age. Then as your child gets a bit older and moves into their school age years, I want you to think about teaching the function of body parts and building independence with toileting and self-care. For example, how to lock and unlock a public bathroom stall so that your child can use a public bathroom space safely and protected behind a locked door. Provide training in assertiveness and self-advocacy, how to say no, to teach boundaries in friendships and other relationships. You're obviously going to continue some of the things you've started early on, like redirecting public and private behaviors and modeling those things. And you'll at this point, it seems early, but you're going to want to start to think about introducing the idea of puberty and the fact that your child's body will be changing in the coming years. Build some basic understanding of human reproduction. Next slide, you'll see a few different visual supports and social stories that can be used to teach about things like personal space. So there are a ton of resources available. I'm trying to capture some for you here, and we will make sure that all of these are sent out to you with resources after the presentation. Next slide. Moving through the preteen years, you can see that things get even more specific. So for example, by providing direct education in puberty, reproduction, and physical body changes, we also want to think about providing direct instruction in menstruation, nocturnal emissions, and masturbation. Again, these uncomfortable topics that we can't avoid for our children with autism. Teach about hormones and emotions. And help to build consistency and independence with hygiene at your child's ability level. So this might include teaching your child increased independence in managing their own menses or cleaning their genitals. We want you to really start to, at this point, normalize sexual attraction and sexual thoughts and feelings, and teach internet safety, including information about recognizing bullying, sexting, and pornography. Be really mindful about messages around body image. And I just want to pause here for a second to note that these timelines are not set in stone, and there may be some things that your child needs to learn or talk about earlier or later than others. And so it's really important to think flexibly about all these concepts and meet your child where they're at. All right, next slide. You'll see a few more examples. For example, a social story for puberty on the next slide. And we'll cruise past that to the next slide as well, thinking about managing those teenage years. So finally, as adulthood approaches and in the later teen years, the unwritten social rules of sexual relationships and behaviors are so complex. They're not often explicitly taught, and this can be really challenging for autistic youth. So we want to make sure that we're supporting our older teens and young adults in developing a number of different skills. And here we want to make sure you're using trusted teachers and counselors and therapists to help you cover topics like how to build safe and healthy interpersonal relationships. We can imagine in our case from earlier today with Chuck, his goal of having a girlfriend probably could use some more exploration, and you guys had some great clarifying questions about sort of why was that important. So helping support that. Also teaching how to explicitly obtain consent, particularly in romantic and sexual relationships. To explore risk-taking behavior, something that's a very natural part of the teenage years, but we want to make sure that we're supporting our family members in taking healthy and developmentally appropriate risks, while also understanding and learning about some of the potential negative impacts of risk-taking behaviors. For example, like how alcohol and drugs can impact judgment, or how we respond to peer pressure. Of course, offer opportunities for role play, provide social scripts, social stories as needed. These can all be really very helpful things to help your child master some of these more complex and sometimes less intuitive social skills. Next slide. Now, remember, as I said at the beginning, it's not too late to tackle these issues. And for many, this learning is going to continue into the adult years as well. We can all reflect on our own lives and know that we've learned much about relationships as adults as well. And that's no different for our autistic family members. So in the next few slides, I'm going to quickly share a couple of resources that might be very helpful for you in supporting you through these topics. And this slide and the one following, you'll see that both Vanderbilt and Autism Speaks have wonderful puberty toolkits. I think we've dropped some of the links to these in the chat already. And each of these includes a number of visual supports that can be helpful for people with different communication needs. Next slide. On this slide, you'll see a resource developed by Dr. Peter Gerhardt, and several other experts and autistic consultants like Amy Gravino, who've been involved in creating this really wonderful resource that is an online sex ed curriculum that can be self-guided, or sections of this could be used as a teaching tool for you or teachers or counselors. Maddie kindly pointed out in our review of this presentation that the name of this resource leaves something to be desired, but the content is in fact really helpful. So I'd encourage you to take a look at that. On the next slide, you'll also see that there are a number of books, and on the final slide here, some web resources. You will see that some of our colleagues in the UK are more prolific in the sex ed space. So on the next slide, you'll see some web resources from the UK that are also quite valuable. Next slide. All right. So once you make it through puberty, our job's not quite done. Next, we get to think about how we support healthy sexuality and sexual behaviors in adulthood. Now, if you've been listening to the last few slides, you'll know that we're already laying the foundation of this through childhood and adolescence, right? But we need to remember that sexuality is a normal part of the human experience for all of us. And for people with autism, they may need some extra support to ensure safe and healthy relationships. So it's important to provide education about puberty, reproduction, and physical body changes, to teach about hormones and the impact of those hormones on emotions, to normalize sexual attractions, thoughts, and feelings, or the lack thereof, and to help create safe and appropriate outlets for those thoughts and feelings. Again, I make a plug for internet safety here. This is something that we obviously need to be teaching much, much earlier on, but the use of internet often changes for young adults and adults. And so we want to make sure we're keeping up with the way that our children are using the internet to continue to support their safety and to continue to be mindful about messages related to body image. Now, remember, with all of these tips, some individuals need this information and instruction earlier than others. So follow your child's unique needs and trajectory. It isn't a one-size-fits-all timeline. And we'll move on here to the next, I think, just the last two slides. So we'll keep cruising. As our teens and young adults mature, it's also really important to make sure that we are helping them understand how relationships change over time and across different people in their life. So recognize that your child's interest in relationships and preferences may differ from your own or from your other children, and all of those preferences are okay. I want to make sure that we're teaching explicitly about the different kinds of relationships that we all have, ranging from acquaintances to helpers to friends and maybe even romantic partners. We want to discuss how relationships either stay the same or change over time, and specifically teach about healthy versus unhealthy or abusive relationships. For example, we want to make sure that our young adults are prepared to identify things like harassment, assault, and abuse, and that they're prepared to know what to do if something like that were to happen in their life. Next slide. Now, obviously, as we talk about these heavy topics through all of this, it is so important for us to pay attention to mental health. And we're really fortunate to have a second session scheduled on transitions coming up this spring that will allow us to focus more specifically on some of these mental health and well-being related issues. But just as a preview, I do want to take a moment to remind you that mental health is absolutely a huge and important part of transition to adulthood. In fact, young adults with autism are often more likely to experience increased anxiety and depression. And there are some things that we can do to help safeguard against those challenges. So the first is, working to prepare for transition. So preparing for transition teaching your child some of these things, being really active in helping them develop more independence around some of these issues can really alleviate some of the symptoms of anxiety and depression that people might experience as relationships are changing as they're getting older. It's also really critical to continue to build self-awareness and effective coping skills in childhood and adolescence to set our young adults up for success. And if you happen to notice a drop in mood or increased depression in the transition years, consider the impact of what we call behavioral activation. So taking small steps like staying connected with your community or scheduling enjoyable activities can really help to safeguard against some of the potentially negative effects of depression. This can be particularly important when schedules change. We talked about our case today that there are transitions in schedules and school and day programming, and those changes can really impact one's mood and mental health. When in doubt, if you're concerned about your young adult, connect with or reconnect with a trusted counselor or therapist in order to seek some support. Next slide. I think I'll pass it over to Amy.
All right. Thank you, Lisa. So I think as we can all see this, move to thinking about transition out of pediatrics and into, adult care, adult services, adult focused agencies and things is not easy, right? So the question and I've asked myself this question as my child, who is now 22, is, aged out of pediatrics, is, are we thriving or are we just existing? So some of the things to think about, I think, as we reflect back on what Lindsay and Lisa and Maddie have presented today are, pediatric years are going to end. Do you have a plan? Are you making a plan? Because adult years are coming. We can't stop them. So think about that. Do you have a plan? Are you starting to formulate a plan? Are you starting to think about who those team members might be? New teams, you're going to have new teams and new strategies are going to need to begin because you're, again, moving out of those pediatric years and into adult years. And this can be really tough. I've experienced it myself. And it's hard to see a lot of these team members leave us, who have been in these young years and they've been with us, for many, many years. But I think if you plan for it, anticipate it, and start to think of it as bringing new opportunity into you and your child's life, it will help you to, I think, get a little momentum going into starting that planning process. The other thing I say is that there's any step towards the process of transition is a good step. So if you haven't done anything yet, take that first step, which might even be, getting some of the materials we've put in resources today, or talking to your provider, or starting to make phone calls for, about new providers. Whatever it is, any step is a good step in the process. And the other thing too is that it's not about how fast you do this. It's about the fact that, you take a positive step, you take a step towards it, and you get there at some point. There's always timelines that people will tell you that you should start thinking about it at 12 and 14, and, you should have it accomplished by 21 and 22. And I just don't think, I think it needs to resonate with what makes the most sense for you and your child's life. So it's not about how fast you get there. It's about taking the steps to get there at some point. All right. So I think we have time for a few questions. So let's go ahead and do questions. You can go to the next slide. Perfect. This slide. So what kind of questions do you have? I'm looking in my chat here. Do we have any questions in the chat right now? Okay, let me get.
There is a good question, Amy, about coverage for services such as therapy or ABA for adults with autism. Yeah. And this is a tough one. I'll share a little bit about what I know, but others may actually have more information. So some of this is going to depend on your specific family member's insurance plan. Many individuals with autism can stay on their parents' private insurance through, I believe, age 26 federally in the US. And that can be helpful for the coverage and benefits that you've been receiving through the pediatric years. And then after that, if your individual is transitioning to a state-funded insurance plan, there may be some differences state to state that you'll have to consider.
Thank you, Lisa. That's good. It's a good reminder too. I think, one of the things that no one's asked this question yet, but one of the things that I would say is that if you're not sure where to start, I think if you have in any of the clinics you're in right now, if there's social work attached to it, I think it's a great place to start asking questions and gathering information. That's kind of what I did and what our family did. We had access to social work. We had access to, a provider who'd been with us for a long time. We knew our time was about to end. So I think starting there to say, what should I do? Where would you go? And start to gather some of that information would be really helpful as well. Any other questions? I'm not seeing any other come in. Does anybody have a hand up? I don't see any.
Amy, I'll say one thing quickly that just some of the questions I was trying to catch myself up. It was already answered by, I think, Dr. Bennett and Lisa to some degree. I just wanted to share for those of you asking about, gosh, what are the adult providers doing, what adult providers do specialize maybe in autism. And while there's not, as me as the developmental behavioral pediatrician, right, there's not a developmental behavioral adult counterpart like there are in some other specialties, but those can, sometimes fold into other, family medicine or even sometimes psychiatry or other fields. I will say that what I have seen, being a part of education of medical residents from various fields over the past few years, is there's a big drive in medical education to do a better job, training those of us who are going to go on to provide care for adults in not just autism, but autism included with some other, developmental disabilities for sure. And so I do think that, and my hope is that this might be a little bit more of a dwindling problem as time goes on, right? But for now, there is still that gap that exists. And so I have a lot of hope and meant to share that earlier, but I do think that there is some hope that will be less of a problem over the next several years.
Yeah, I think that's a great point, Lindsay. And I think the one thing that I would say to families that are out there is think about how you can partner with, your new providers. We just gave you a host of different resources. Bring those to clinic visits, because the chances that they've seen some of these materials is not as strong as it is in pediatrics. Like Lindsay's pointing out, it's getting better, but I think if you can be the resource parent and start to bring some of that information in, share your experience, share how you think it could go better, and make yourself available to some degree and build that partnership, that can also help not just you, but families who have children younger than yours who are going to be coming into that transition and adult phase at some point.